This is a patient who came in with some abdominal pain. We got a CAT scan with intravenous contrast. And as we scroll down, you'll notice in the left upper quadrant, left mid-abdomen, there's a lot of inflammatory change. And there's also some fluid that's associated with this, a developing collection of sorts, not quite organized yet, but at least partially loculated. And it's really intimately associated with several loops of bowel over here. Some of them contain contrast. And so hard to know what's causing this based on these images itself. It's possible there's a small bowel diverticula which has undergone inflammation, so small bowel diverticulitis with some fluid that's developing. In this instance, when we look back on a prior study a little while ago on the same patient when they did not have abdominal pain, we can notice that in some of the same loops of small bowel in the left upper quadrant, there's almost this sort of lobulated mass-like lesion associated. For example, with this loop, if we just focus on this area here, there's sort of a mass on the undersurface of it. There's also a similar appearing mass on other portions of those loops of jejunum right over there. And really that appearance of these masses with those lobulated margins looks very similar to the pancreas itself. And so these findings, these masses in the small bowel essentially are ectopic pancreatic rests, and in this instance, one of them has undergone inflammation or pancreatitis, resulting in all this fluid and inflammatory changes in the left side of the abdomen. Now, these pancreatic rests are uncommon when we do see them. They tend to be in the stomach or a proximal portion of the duodenum. They can occur from time to time in the small bowel, particularly the proximal small bowel, and that's what happened in this instance.